are going to discuss about the relations of temporomandibular joint. We have 6 relations which are anterior, posterior, superior, inferior and medial and lateral. So first we are going to discuss on the terminal branches of the external carotid artery, which usually comes in the relations of the temporomandibular joint. Out external carotid artery, and it gives 2 terminal branches, which are the first one. This is the superficial temporal artery, and the second one, this is the maxillary artery. So this is our external carotid artery, and this is superficial temporal artery, and this is our maxillary artery. And this maxillary artery along its course divides into 3 parts, and from these parts it gives its branches. So in here TMJ, only 2 branches of maxillary artery take part. So, and the 2 branches are, the first one, that is the middle meningeal artery. Why I have drawn dotted here, I will explain later. And the second one, the mesenteric artery. So the first one, that is the middle meningeal artery, arises from the first part, and the mesenteric artery arises from the second part. So this is the middle meningeal artery, and this is our mesenteric artery. So then here is our temporomandibular joint, anterior position, and so this is the posterior, and this is superior, and this is the inferior, and above this paper, that is from where we are viewing, that's the lateral, and behind this paper and behind this book, that is the medial. So hope it's clear the arterial relations of temporomandibular joint. So from the anterior part we have the mesenteric artery, inferior part we have the maxillary artery, and posterior part we have the superficial temporal artery, and the middle meningeal artery, it comes in both the superior relation and also in the medial relations. So these are the arterial relations of temporomandibular joint. Now we are going to the other relations. Okay, then first we may mark the anatomic positions. So the anterior, posterior, superior, inferior. Here we may mark the medial, and here is the lateral. Medial behind this book, and lateral from where we are viewing. So these are the anatomic positions. So first we may write the arteries. So excepting the lateral relations, all other relations have the arterial relations. So then other relations. In case first we will discuss about the anterior. Anterior is anterior relation, that is lama. Okay, the ma, that's a mesenteric artery. Then what is la? It is lateral pterygoid muscle. So anterior relations, lama, that is the lateral pterygoid muscle, and the mesenteric artery. Now going to the posterior relations. Posteriorly it is pars. So the S for the superficial temporal artery, and F for auriculo-temporal nerve, and P for parotid gland. So posteriorly pass parotid gland, auriculotemporal nerve and superficial temporal artery. Then going to the superior relations. Superiorly, one relation is middle meningeal artery and other relation is middle cranial fossa. Middle cranial fossa. We said that this is lateral view. On lateral viewing, there will be superiorly the cranial fossa. Cranial fossa have three parts: anterior, middle and posterior. So the TMJ will be in the middle cranial fossa. That is the superior relation. Then going to inferior relation. Inferiorly only one relation. That is our maxillary artery. Then we go to the medial relations. Medial relation, we have two bone, two nerves and one artery. Okay, two bone, two nerve and one artery. The one artery is middle meningeal artery. Then what are the two nerves? First nerve is cauda tympani nerve. Cauda tympani nerve. Second one is the auriculotemporal nerve. Auriculotemporal nerve. And the two bones, one spine of sphenoid and tympanic plate. Tympanic plate. So two bones, tympanic plate and spine of sphenoid, two nerves, auriculotemporal nerve and cauda tympani nerve, and one artery, middle meningeal artery. The medial relations we can also study from the picture that is familiar to us. So this is our temporomandibular joint, and medial to that, two nerves, auriculotemporal nerve and cauda tympani nerve, and one artery, the middle meningeal artery, and the bone, spine of sphenoid. Now the last relation, that is the lateral relation. It is very simple, and that is late to first special class. We are usually late to special classes. So late, that is lateral relation, and first F, that is a facial nerve. The temporomandibular joint, it's a joint between temporal and mandibular bone. So there will be the temporal branch of the facial nerve. Temporal branch of facial nerve. And then S, that is skin and fascia. Skin and fascia. And P, that is the parotid gland. So laterally also three relations: skin and fascia, parotid gland and the temporal branch of facial nerve. So these are the relations of temporomandibular joint. Hope it is clear to all, and thank you.